Have you noticed your puppy with a bloated belly or grain like rice in your dog's feces? Is your cat experiencing vomiting, diarrhea, or has a rough hair coat? If this sounds familiar, your pet could be dealing with roundworms, hookworms, whipworms, or tapeworms. In this episode of the Pet Care Pro Show, we have Cynthia joining us.
Hi.
And we will be answering the question of, how do I know if my dog has worms? And if so, what should I do?
Yes, and I also have some tips on how to keep your dog or cat from picking up worms in the first place.
Very good there. Now, before we start, we ask you to consider subscribing to the Revival Animal Health YouTube channel by clicking this little red heart or the subscribe button down below if you're watching this on YouTube. Okay, let's talk worms. Unfortunately, intestinal parasites or worms have been around forever, so they won't be going away anytime soon.
Yes, that is why managing them is the key. Remember, parasites don't want to kill your pets. They just want to use them as a dinner plate. So your job is to manage parasites with the correct dewormer at the right time.
For sure, and not all worms respond the same way to every dewormer. So first, you need to determine what type of worm you are dealing with. Now in this video, we are going to focus on 4 of the most common intestinal parasites. They are roundworms, hookworms, whipworms, and tapeworms.
Yes, roundworms are 2 to 7 inches long and look kind of like spaghetti. If puppies or kittens are vomiting parasites, it is most likely roundworms. Meanwhile, hookworms are only about 1/2 inch long and are difficult to see without a microscope. And coughing isn't something you may immediately associate with those parasites, but both roundworms and hookworms can play a role in the 8-week-old puppy cough. Other symptoms of hookworms include vomiting, diarrhea, stunted growth in the smaller animals, a dull or dry coat, loss of weight, lack of appetite, loss of color in the gums and the lips, and occasionally dark, tarry stools.
And hookworms can eventually lead to anemia.
That is correct, because hookworms are feeding on the animal's blood and leaving bleeding sores with their teeth, or cutting plates, as we call them. The animal can rapidly develop anemia, which causes weakness and shortness of breath.
Okay, now let's talk about whipworms.
Whipworms are thin worms that live in the large intestine and are usually 1 to about 3 inches long. They receive their name from the worm's shape, which has a thinner front end and then a wider, stout tail, making it resemble a whip. Symptoms of whipworms include a chronic loose stool, often containing mucus and blood. However, heavier infestations may cause weight loss, anorexia, and diarrhea.
Okay, and really the most accurate way to diagnose whipworms and hookworms is under a microscope.
Yes, vets will diagnose whipworms and hookworms by looking under a microscope for eggs in the dog or cat's feces. Whipworms are frequently difficult to diagnose. Their eggs are only shed intermittently in the stool, and there is not yet a test to detect the parasite's protein.
Now, what about tapeworms? We hear a lot about those, especially in dogs or cats that have fleas.
Yes, if your dog has fleas, or you see little flat white grains of rice in your dog's droppings, there's a good chance your dog has tapeworms. Pets can't get tapeworms directly from other dogs or cats. Tapeworms live in the large intestine and are transferred to your pet most often through an intermediary host. This means tapeworms can get transferred if the animal eats a mouse, a bird, or a flea infected with the tapeworm.
Okay, and there are actually 2 different commonly detected types of tapeworms, correct?
Yes. One comes from the rodents and the rabbits, and then the other type comes directly from the flea.
Okay, now roundworms, hookworms, whipworms, and tapeworms are just 4 of the many types of intestinal worms out there, but they are the most common.
Most common. Yes, roundworms and hookworms both live in the small intestine and are by far the most common intestinal worms found in both puppies and kittens. And while tapeworms in humans are rare, both roundworms and hookworms can infect humans. So you want to make sure these are gone before sending a puppy or kitten to a new home.
Okay, and if you aren't sure but suspect your pet has worms, you want to take them to your vet right away, because left untreated, no matter what kind of parasite it is, it can really make your pet sick.
Definitely. And your vet will probably want to have a fresh stool sample, if you can get one, if available. If worms aren't treated, remember your pet can experience weight loss, vomiting, diarrhea, or just that rough hair coat.
Absolutely. Now let's talk treatment. Deworming on a regular basis is important, but take note that wormers often have different active ingredients, so they don't all work the same.
No, they don't. It's important to know what each active ingredient does. For example, if you're dealing with roundworms or hookworms, pyrantel pamoate or fenbendazole are both safe and effective ingredients that kill these particular parasites. Fenbendazole also works well for whipworms, but it does not kill tapeworms. The drug of choice for tapeworms is praziquantel.
Absolutely. So when you're looking to buy a dewormer, you really have to look closely at the ingredient list and make sure it treats what you're dealing with. And to help with that, we have several articles in our Learning Center on worms and dewormers, including one article called Active Ingredients in Wormers. You can find a link to that in the description below or on our website at revivalanimal.com.
And you can always give me a call if you aren't sure what type of dewormer you need. I can help you find the best treatment for your pet.
Absolutely. You do that every day.
Every day.
Now, I want to talk about a deworming schedule and how often it should be done. But before we do, if you are finding this video helpful, click the like button below. Okay, so when do you recommend deworming puppies and kittens?
Good question. Worms in puppies and kittens are common. This growth phase of their life is when they are most susceptible. That's why I recommend deworming puppies and kittens at 2, 4, 6, and 8 weeks of age, and then again at 12 and 16 weeks of age, followed by 6 months and 1 year. Then deworm regularly as an adult.
Okay, so what about adults?
Adult dogs and cats are a little different. Use of monthly heartworm preventatives that also contain praziquantel will give regular monthly protection from parasites to you and your pets. You also have to look at your animal and assess their risk of getting worms. If your dog or cat is a big hunter, they will need more frequent deworming. A general rule of thumb is to deworm adult dogs and cats twice a year for life. If you have a cat that is strictly indoors though, Shelley, deworming once a year is usually going to be enough. If it's an outdoor hunter, 3 times a year may be necessary. Again, I can help you figure out how often your pet needs to be dewormed. Just give me a call.
Thank you so much, Cynthia. You have great advice. And if you found this advice helpful, please share this video with others. And if you have any other questions, comment below and we will get those answered. I'm Shelley with the Revival Education Team. This is Cynthia, a Revival Pet Care Pro. Thank you so much for joining us on this roundworm, hookworm, whipworm, and tapeworm episode of the Pet Care Pro Show. Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel so you don't miss our new videos. If you have more questions on worms or any other pet health issue, call our Pet Care Pros at this number or check out our other pet health videos.